Headache. It's important in AMC exam. Let's start by migraine headache. It's very important. It's unilateral headache, pulsatile inequality, lasting from 4 to 72 hours. I mean it's long duration headache, and this is very important related to migraine. It's associated with photophobia and phenophobia, which mean afraid from sound and afraid from light. It's common in female, especially the young one, and it's associated with nausea and vomiting. Migraine headache is increased by stress and tension, and it's decreased by sleep and vomiting. It can proceed by something called aura, which is a neurological symptoms that precede the attack of migraine, okay? Now, if you look at this picture, this represents migraine headache. I mean, it's unilateral headache, pulsatile in quality, and it's lasts from 4 to 72 hours. It's long duration headache. For treatment, the first line of treatment of migraine is non-steroidal anti-inflammatory drugs, which is the main line of treatment. Prefer to use caffeine with non-steroidal anti-inflammatory drugs. If the first line failed, then use the second line, which is sumatriptan. And if second line also failed, then use the third line, which is ergotamine. So please focus on this. It's all important. Remember, in children and pregnant women, the drug of choice is paracetamol. Never use non-steroidal anti-inflammatory drugs in case of children and in case of pregnant women, as these are contraindicated, okay? Remember that. And also, in women with aura, I mean women suffer from migraine with aura, oral contraceptive pills is contraindicated. It's very important. Migraine with aura in women, OCP is contraindicated. But migraine without aura in women, OCP is okay. And best drug for prevention of migraine is beta blocker in all patients, okay? So for prevention of migraine, the best drug is beta blocker. Now, most common cause of headache in children is migraine. Headache before or after menstruation is migraine. Remember, avoid alcohol, caffeine, chocolate in patients with migraine, as these can increase the attack of migraine. Migraine can cause abdominal pain in children. Also, it's very important. Migraine can cause hemiplegic paralysis in children. Please, all these important notes, remember them, focus on them, and memorize them well. Now let's talk about cluster headache. The keyword for cluster headache is that man, and remember, man, not women, suffer from retroorbital pain with red eye and runny nose. This directly means cluster headache. I mean, cluster headache is more common in men, not in women, and it's retroorbital pain with red eye and runny nose. Remember these. It can cause ipsilateral Horner syndrome. I mean ptosis and other symptoms of Horner syndrome. For prophylaxis, it's done by calcium channel blocker like verapamil, not beta blocker, as in migraine. For treatment of acute attack, it's done by using 100% O2, which is very effective in relieving the pain. So remember, cluster headache, it's unilateral retroorbital pain, okay? Retroorbital pain, and it's common in men. So any case scenario talking about headache, retroorbital, and in men, put in your mind cluster headache. And finally, tension headache. Tension headache is more common in female, and the keyword of it will be female suffer from band-like headache. It's around forehead, temple, and neck. It's important. It's band-like headache. If you look at this picture here, this represents tension headache, which is a headache surrounding the head, temple, and neck. It's usually common in female. For the treatment, the first line of treatment is massage and relaxation technique. It's important. And the second line of treatment is non-steroidal anti-inflammatory drugs. So please, finally, remember these. Migraine, it's unilateral headache, common in female, while cluster headache is common in male and it's retroorbital pain. For prophylaxis of migraine, it's done by using beta blocker, and for prophylaxis in cluster headache, it's done by calcium channel blocker like verapamil. And for treatment of tension headache, it's relaxation and massage technique. That's all. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.